Good afternoon, and thanks to everybody who has joined us for our Faith and Facts Fridays discussion with Dr. Fauci. Thousands of individuals from across the Commonwealth have registered for today's event, and we are so happy that you have taken time out of your busy schedules to hear from our leadership today. I am Sable K. Nelson Dyer, Acting Director of the Virginia Department of Health, Office of Health Equity, and Chair of the Virginia Emergency Support Team's Health Equity Working Group. The Health Equity Working Group is the first equity mechanism established within a Virginia Unified Command for a state emergency incident, and it's what connected Dr. Janice Underwood, the first cabinet-level diversity, equity, and inclusion officer, Dr. Robert Wynn, the director of the VCU Massey Center, and myself. And you'll be hearing from both Dr. Underwood and Dr. Wynn shortly, but it's because of the synergy of these great and dynamic leaders across the country, across the Commonwealth, that brought one of our nation's leaders in infectious disease to speak to you today. Before we formally begin, I would like to share with you a few housekeeping items. First of all, I want to let you know that this event is being held primarily via Zoom, but it's also being simulcast on Facebook Live on the Facebook pages of the Commonwealth of Virginia's Governor, Ralph S. Northam, the Virginia Department of Health, as well as the VCU Massey Cancer Center. There are also a few national and local media outlets who are streaming the event as well. And just wanting to thank our partners for their continued support. Secondly, would like to make you all aware of the several accommodations that we have made for today's event. The first accommodation that I would like to let you know about is American Sign Language, wanting to thank our two sign language interpreters, Elaine Hernandez and Bernice McCormack, for their services today. Those individuals will be pinned to your screen, so you should be able to see which of the two of them who are providing those services for you all. And you should be able to look at them and be able to see them whether you're joining through the Facebook Live or via Zoom. The second accommodation I would like to tell you about is Virginia Relay Remote Conference Captioning. We want to thank them for providing the captioning services today. To access RCC, you must use a link to view the captions. The link will be shared for those who are participating via Zoom in the chat box, and you all will be able to look at the captioning for the event. And for those of you who are joining via Facebook, the link for the RCC closed captioning is available on the VDH Office of Health Equity Facebook page. Wanting to let you know that we are encouraging our simulcast streaming partners to share the RCC link on their respective Facebook pages so we can ensure the accessibility for as many of those who may need that specific accommodation. Also wanting to let individuals know that we have Spanish interpretation. Thank you to Maria Ayoso for providing Spanish interpretation services today. For those who need the Spanish language translation,
Come sit down over here. Are you going to take notes or you want me to take notes?
Welcome to all of you who are here in attendance for our media roundtable. We'll be starting in a very few minutes. If you would please ensure that you keep your mics muted until and unless we're able to call on you. And I will be starting very shortly and then reading the rules of engagement. So thank you, and we really do appreciate you being here. We'll be starting very shortly. Just want to welcome each of you here. We'll start in about approximately 2 minutes. So excellent, we're gonna begin. So good afternoon, thank you for joining us today. My name is Nahaka McFadden and I'm from the National Guard Bureau Public Affairs Office, and I'm gonna be moderating this media roundtable on the National Guard's support to DC law enforcement and the inauguration. This is scheduled for approximately 45 minutes and is on the record. Before I begin, I ask that you continue to remain muted until I call on you for your questions. And when asking a question, please identify yourself and your outlet. Because we have so many of your interests today, please go ahead and ask your most important question first. And then if we're able to go through the list, then you can ask a follow-on. So the rules will be ask one question, and then we're going to be going to the next outlet. So we're going to begin today. Air Force Major General Steve Nordhaus, who's the Director of Operations for the National Guard Bureau. He's going to begin to provide us her statement, and then we're going to continue and go down to other subject matter experts that we have today. All of their bios were provided in the media release. And at the end of this media roundtable, if we have any open questions or anything, we will follow up with you and provide the information as requested. So for now, I'm going to go ahead and turn it over to Air Force Major General Steve Nordhaus, sir.
Thanks, Ms. McFadden, and welcome today. Good afternoon. I'm Major General Steve Nordhaus, the National Guard Bureau's Director of Operations. Thank all of you for joining us here today. First, I want to say how sorry I am about Wednesday's horrific events. It was a dark stain on our democracy and does not honor the nation I serve. We look forward to working with our local communities, federal partners, and all to help heal our nation. As I speak, nearly 6,200 National Guard men and women from Delaware, Maryland, New Jersey, New York, Pennsylvania, and Virginia will join the District of Columbia to provide law enforcement support to federal and DC authorities through the presidential inauguration on 20 January. These members were authorized by Acting Secretary of Defense Christopher Miller to report to the DC Guard for up to 31 days under Title 32 502F authority. What I'd like to do before we go any further is to explain how the National Guard is called up in emergencies such as this. When requested for National Guard assistance, it generally comes in from a local authority that's requesting generally a governor to provide additional assistance and the National Guard to support them. The governor then approves, and that support is provided through the adjutant general from that state to the local community as required. The District of Columbia is different. It does not have a governor, so that would be under Mayor Bowser or a federal agency asked for a request. And then that request generally goes to the commanding general of the District of Columbia, and it's supported through the Secretary of the Army and the Secretary of Defense to authorize that support. With us today, we have Army Major General Tim Gowan, the Adjutant General for the state of Maryland. Also with us is Army Brigadier General David Wood. He's the Director of the Joint Staff from Pennsylvania. And Army Colonel Lisa Howe, the Interim Adjutant General for the state of New Jersey. At this time, I'd like to open it up to the first question.
Sir, we're going to first have Major General Timothy Howe Gowan to provide any of his statements first.
Okay, thank you.
Thank you, sir.
Yeah, good afternoon, everybody.
Sources like the CDC, your care provider, the Virginia Departments of Health and Emergency Management, the governor's office, and yes, Dr. Fauci. We know there are already many fraudulent vaccine scams going on. So please be on guard, because there are folks out there that will attempt to use this moment for their personal gain. So let's jump in and have a great conversation. If you're ready, let's go. I have the distinct honor of introducing our next speaker, Governor Ralph Northam. During a particularly difficult moment in our history, Governor Northam brings his experience as a doctor, a business owner, state senator, and former lieutenant governor to this historic time in the Commonwealth. Might I add, we are the only state to enjoy the leadership of a doctor during a public health crisis in the governor's office. Governor Ralph Northam, the 73rd governor of Virginia, has a heart for all people, especially those who have been historically marginalized and underrepresented. And it is this love for all Virginians in particular that guides every decision he makes. Please welcome the 73rd governor, Governor Ralph Northam.
Well, good afternoon, and thank you so much, Dr. Underwood, for that kind introduction. I hope all of you are safe and healthy. You know, this is an exciting day for a couple of reasons. First of all, Dr. Anthony Fauci is a friend and health expert who we have all come to know and trust. And we are so excited that he's here with us today. And I'm looking forward to talking and hearing more about the vaccine. Finally, there is hope and light at the end of a long, dark tunnel. I want to thank everyone involved in this event today, the Faith and Facts Friday group, and Dr. Robert Wynn, a member of our state's Health Equity Working Group and the director of the VCU Massey Cancer Center. He is the only African-American director of an NCI designated cancer center in the entire nation. And we are so grateful to have his leadership right here in the Commonwealth of Virginia. I also want to welcome Dr. President Rao from VCU. Thank you so much for your leadership and your friendship. Dr. Underwood, our Commonwealth's Chief Diversity Officer, members of our Office Diversity, Equity, and Inclusion, and the Department of Health's Office of Health Equity, to Congressman Bobby Scott and other elected officials, and all the faith and community leaders who are with us this afternoon. This has definitely been, as Dr. Underwood said, a team effort, and we're proud of our team here in Virginia. And again, I want to thank and welcome Dr. Fauci for joining us today. Dr. Fauci, I just want you to know, to honor you, I have my own Dr. Fauci face mask. As a doctor myself, I have been so grateful to Dr. Fauci for his steady, science-based, factual leadership during this pandemic. You know, it has been a long and difficult 10 months for everyone. The COVID-19 pandemic has literally turned all of our lives upside down. Thousands of Virginians and Americans have lost their lives. Many more have lost jobs and livelihoods, businesses that they built, and even more. Many don't know if and where their next meal is coming from. Children and their families have suffered, and everyone has suffered from the isolation, fear, and uncertainty. The development of vaccines against this virus are a marvel of science and international cooperation. It is nothing short of amazing that we have these vaccines in such a short period of time. I want to be clear that while the vaccines have been developed quickly, that is because the smartest and most talented scientists have worked around the clock, and because governments have reduced red tape. No one has cut any corners. Vaccines do not give you the disease. Instead, they spur your body to produce antibodies to the disease. As a matter of fact, this vaccine does not use a live or attenuated virus. You will not get COVID from the vaccine. Scientists know how to create vaccines that work and are safe. So I have no hesitation about taking this vaccine when my turn comes. And I hope everyone watching today will do the same and urge their friends and family to get vaccinated too. That is our only real way out of this pandemic. We must get a large majority of the population vaccinated, and the sooner, the better. Now, I know the news reports say that the vaccine rollout hasn't gone as quickly as planned, but both here in Virginia and nationally. But this is also the biggest vaccination program we have seen in our lifetimes. We have 2 vaccines now, with more expected later, and both need to be kept cold. The logistics are incredibly complex, and so are the sheer numbers. Right now, Virginia is getting about 110,000 doses of vaccine a week. between the Pfizer and Moderna vaccines. But we have 8.5 million people, and both of those vaccines require 2 doses spaced out. Now, we expect to see our weekly vaccine allocation ramp up as production increases. This week, I announced an initial goal of 25,000 vaccinations a day, and we expect to increase that goal as we get more supply. As you know, I've put Richmond Henrico Health Director Dr. Danny Avula in charge of coordinating all of this. And I've urged our vaccinators to get vaccine into arms as fast as they can. But it's still going to take some time to get everyone who wants the vaccine. We're committed to getting there as expeditiously and equitably as possible. And I hope the majority of Virginians will get vaccinated. The vaccine is the way to stop this virus. It's our path forward to recovery. And it's the clearest way we're going to get back to something that feels like normal. I hope our faith leaders and all faiths and all of the community leaders who are on today will be strong partners in this effort. You are trusted leaders in your communities, and you can be a huge help in getting the word out that vaccines are safe and that people should take them. I know that many people are worried because of the vaccine, because of the past racist experiments and medical practices done on our 2 people of color. I understand that. I can't change the past, but I can say that we are working hard to earn trust in diverse communities, and we do that by listening to our residents and getting facts and information on these vaccines to people in all communities, especially communities with justifiable mistrust, to help answer questions and give reassurance that the vaccine is safe to take. We need everyone's help in this effort. So I am so excited to hear from Dr. Fauci today, and I know all of you are too. I'm again so grateful for his leadership these past months, and I'm glad he's going to continue his wonderful work in the new Biden administration to lead in our recovery. Dr. Fauci, thank you for making the time to join us today, and welcome to the Commonwealth of Virginia. And thanks again to VCU and our Health Equity Working Group for making this event possible. Happy New Year, and stay safe and healthy.
Thank you, Governor Northam, so much for your remarks. And we will now transition to hear from our next speaker, President Rao, who will be introducing Dr. Nguyen. President Rao, are you there?
Yes, I'm here.
Excellent.
Okay. Governor Northam, thank you very much for all of those kind words, and thank you for your continued partnership with all of us. I'm also pleased to join in here and welcome Dr. Fauci. I'd like to say Director of our National Institute of